Good morning and welcome to today's webcast, How Lean Reduces Waste and Improves Value in Healthcare. Before we begin, I'm going to play a brief housekeeping video.
Welcome, and thanks for joining us. We're pleased to present another in our ongoing series of continuing professional education webcasts to help companies and individuals conquer challenges as they plan for what's next. Our presentation will start in a few moments. Before we begin, here are a few things to keep in mind. You can customize how you both view our presentation and interact with the presenter. For better viewing, close all other applications and turn up your speaker volume. You can also adjust window size and placement or enter full screen mode using the controls at the top of the window or dragging the bottom right-hand corner to resize. At the bottom of your screen, you'll see a series of icons, each relating to a different aspect of our session. You can download the group attendance sheet and a PDF copy of today's slides from the slide deck and handouts widget to the right of the slide view. You can ask our presenter questions during the webcast by typing a question in the Q&A window below the slide view and clicking Submit. We'll do our best to answer all questions during the presentation or follow up via email. If you experience technical difficulty during today's presentation, refresh your browser by hitting the F5 key. Today's session will offer you 1 CPE credit. To receive credit, you must meet the requirements as specified by the National Association of State Boards of Accountancy. You must attend at least 50 minutes of the session and respond to at least 75% of the polling questions, which we'll ask throughout today's presentation. To respond to a poll, click the button next to your answer. We'll track your progress and alert you when you've earned CPE credit. You can then click the certificate icon in the CPE Progress widget to open a PDF file that you can save to your computer. Don't worry if you can't download your PDF certificate today. We'll email a copy to you in 2 weeks. If you're attending this webcast in a group, you must complete our attendance sheet to receive CPE credit. The attendance sheet is available in the slide deck and handouts widget. Please have all group members sign it and send only 1 sheet per group. Also note that CPE credit can be awarded only to participants registered as themselves and isn't available to participants who view the on-demand version. As a reminder, the presentation you're about to see isn't legal, investment, or accounting advice. We encourage you to seek the counsel of a professional service provider to apply this content to your specific circumstances.
I'm pleased to introduce today's presenters from Moss Adams Lean Healthcare Practice, Craig Vercruysse, Partner, and Bonnie Jacobson, Director. And with that, I'll turn it over to Craig to get us started.
Thank you, Emily. This is Craig Vercruysse, everyone, and thank you for joining us today. We're pleased to share with you a little bit about lean in healthcare and how it can improve value by eliminating waste. And looking at the registrations of a few hundred people who signed up, we're grateful to all of you for taking the time, and we see that there's some old friends in the lineup as well as some new ones. This agenda today, as you can see outlined on the screen, is really focused as a foundational webcast that we will build upon in the coming months with several of our other colleagues and partners who will share with you very specific case studies and topics related to lean in healthcare. And today, my longtime friend and colleague, Bonnie Jacobson, and I are pleased to give you a foundational background. So for some of you, this may be old news, but we have a few additional twists to share with you. And for some of you, this may be your first time ever thinking about or listening to how lean can be applied in healthcare to change cultures and eliminate waste so that ultimately we can serve patients and communities at a much higher level than we do today. So I'm going to start us off here with a polling question just to get a flavor for where the group is at. And how familiar are you with lean as a performance improvement approach? And you can see the scale here. So just take a moment and check the box, and we will see the results here in just a moment to see where our audience is. Now, as we're doing that, I want to give you just a little bit of context. Lean may not be for every healthcare organization, depending upon where it's at in its maturity and in its cycle of evolution. Some organizations have very, very steep turnaround steps that they need to take, and lean may not be the best applied in those situations. We have found some of the best situations in which lean is applied is when the organization has significant challenges that they want to face, and they have some breathing room to do so, and have the right mindset about continuous improvement. If it's an organization that is very much in a firefighting mode and they're fighting for survival, it's a much different scenario, and that may not be the appropriate approach. But for many organizations, it is a very appropriate approach to get to unprecedented levels of quality, safety, service, and ultimately then we believe that if quality, safety, and service are improved, the finances will follow, just as our teachers from Toyota have taught us. So here we have, we should have some results on the screen here, and I'm not seeing them, Emily, so maybe, let's see.
I'm not sure what happened there. Why don't we continue, and I will look into it on our end.
Okay, very good. Well, we'll move on, and I'm going to assume that we have an audience that is probably somewhat familiar to not very familiar, but let's just start with, basic, part one of this. Why do we need improvement in healthcare? The main reason, there's two reasons we've distilled this down to. Number one, the leaders in healthcare have just a competing set of challenges in a really dynamic and complex marketplace. We all know this. Healthcare is not getting any less complicated with the amount of regulation, the amount of reform that is happening largely in the payment space. It's becoming more and more difficult to navigate the landscape. When I was an executive inside of the Sutter Health System, one of the challenges that we faced time and time again was just the increasing amount of regulatory pressures on us. And my lineage is my mother was a nurse for 35 years. And one of the things that she always says since retirement is, boy, it's just getting harder and harder to take care of patients on a daily basis. On the front line, it's just getting more and more pressure-packed. So at the same time, we have these difficulties navigating the landscape of healthcare. The front line is overly burdened with waste. We see this in the burnout numbers. We see this in the turnover rates. And frankly, it's just not acceptable because at the end of the day, as people who lead healthcare organizations, we need to make sure our number one duty is to help the people on the front line who take care of the patients. My father-in-law, who was also a hospital administrator, used to say it's a privilege to serve our patients and our communities. And it is. And that privilege comes great responsibility to make sure that we can alleviate the burden so that the patient care and the value created for patients and their families is exceptional. Now, one of the challenges that we see in healthcare, and I'll simplify this a bit, is the media. You cannot open a publication or see a headline in healthcare without oftentimes it being negative. And so where's the hope in healthcare? We see these reports which are very, very well grounded in research such as JAMA about the amount of waste in healthcare totaling $1 trillion, or the burnout rates of physicians at 54%, and the burden placed on the worker. But we need to have a better way, and I've seen this time and time again in the application of lean in healthcare, where it truly changes the lives of the individuals. And when teams come together and apply a lean management system, which you'll learn more about the foundation of it in a moment from Bonnie, you see a lightness come to them. You see hope come to them. You also see results. So this is not just something that makes us feel good. It's something that makes us feel good and gains results. I was recently with a client on the East Coast, and it was a chief medical officer of a mid-sized institution, and we were rounding, doing his leader standard work, and he came to the sterile processing department, and the energy in the room around problem solving from the supervisor of sterile processing and the team as they were trying to figure out their problems and how to solve their problems around supplying the OR with sterile instrumentation was palpable. They had hope. It wasn't because they solved the problem. It's because they were thinking together and they had a leader who was there to help. And collectively, as a team, they were focused on the patient and eliminating defects and waste. This is a much different story than it was a year ago at that organization, where You might not have even seen the chief medical officer rounding on sterile processing. But when we apply lean in healthcare time and time again, we see these hopeful moments appear. And with that, I'm going to turn it over to Bonnie to give you a little bit more on the waste in healthcare and start laying the foundation for what is a lean management system.
Well, thank you, Craig. I'm happy to share this slide with all of you and start talking about those elements of a lean management system, because I have myself experienced many times and witnessed the powerful impact that these kinds of behavioral changes can have. So first I want to talk a little bit to you about how the waste, when we say waste, how does that manifest itself? What does that really mean in the day-to-day operations? And you can see on the slide there's safety manifestations. Hospital errors may be the third leading cause of death in the United States. If you think about that, it's just really kind of an earthquake when you look at it that way. For people who engage with an industry regularly, they need something. They may need it very urgently. They're vulnerable in that moment, and they come to us for help, and we can't really guarantee them that the help that they receive will be safe. We can't guarantee them that the quality will be high. And when we engage with other industries where safety and high quality are really important, there's a general belief that it should be done correctly every time. And we've gotten to a place with healthcare often that we're willing to accept. We create the impression that we're willing to accept a certain amount of imperfection. And that's something that really needs to be looked at and addressed. Where are we philosophically? Do we believe it's possible for things to be perfect? Do we believe that injuries are avoidable? And in the lean world, we do believe that. We do believe that you should be striving for that all the time and that you can get there. These types of issues are preventable. They're solvable. They require tenacity in being transparent and understanding the process closely, being hard on the process, but being easy on the people. You hear us say that a lot. We take this really strident stance on process, but then we say people are doing the best that they can given the processes and the systems that they're asked to work within. And if the process is improved and the system is improved, the results will improve. And that's one of the ways that we demonstrate respect for our people, which I'm going to talk about in a moment. I also want to draw your attention to the part of the slide that talks about engagement and burnout. 54% of physicians report burnout symptoms. Oftentimes in the literature, you'll see that the word burnout isn't even used anymore. That wording has been changed to talk about moral injury and how clinicians of all levels feel a sense of moral injury in that they come to work each day with a mission inside them to deliver the highest quality possible care. And the systems and the processes are not designed to support them in doing that. And so it's so frustrating because they feel that they can't make good on the promise they made to themselves or to their patients in how they want to care for them. So that, to me, is always a really powerful statistic. So looking at lean, some of you who have lean experience, you may have seen the Toyota House. And the Toyota House, the original, more sort of classic traditional version, gives you information about the structure of the methods. You know, these are the resources and the types of techniques that you can apply, and these are the outcomes that you'll achieve if you apply those techniques and methods. And all of that is very important, and that's more the how. This is a little bit more about the philosophies of Toyota, and to me, this house is of equal importance to the other because it starts to help you understand what kind of approach and beliefs need to be in place, what philosophies need to be in place in order to really make this work and to sustain it. So in this house, you'll see a much simpler drawing. If you've seen the other house, you'll know. But here you'll notice that the two pillars, continuous improvement and respect for people, those are the things that are holding up and supporting our structure. But underneath the foundation are the key philosophies of Toyota, and what I want to draw your attention to is how respect is there as well. Respect appears twice in this framework, because what we're doing is really about demonstrating respect for the people who do the work, for our customers who receive our work, and for each other as leaders and colleagues and partners. That's the fuel that drives all of it, and it's a crucial element. Somehow the slide moved forward on its own. Okay, that's amazing magic. This slide I would like to show you really talks about where how do you get this whole thing started? How do you move and build the culture that you need in order to roll lean out, or in order to advance it if you've already rolled it out, or to sustain it if you've already rolled it out and now you've been doing it for a while and it's getting tougher to keep things going in the direction that you want, and to hold your gains. It's important when you're looking at embedding lean or keeping it where it is or advancing it, to think about these elements. And I kind of liken this to the idea of having integrity and having all of the elements integrated. So first you have to have the beliefs, your core philosophies. Do you really believe that perfection is possible and that injuries are avoidable and that you can have that kind of high-performing organization? If you believe that, now you're talking about, well, who else is joining me in those beliefs, and how can we move our organization culturally in that direction? And to do that, you start to engage in certain types of behaviors. And those are the ones that you were mentioned on the slide previous: showing respect for people, going and seeing where the work is done, operating as part of a team, accepting challenge. Those are the beliefs and behaviors you're going to start to demonstrate to your people, and that then results in more specific action. And when you do those things ongoing and continually, that's where you really start to see the change happen, and it grows roots and begins to spread. This is, Craig mentioned that he has a family background with some folks in his family who've been clinicians. I don't enjoy that luxury, but I myself have an experience in my background of being a social worker. I was a social worker for about 20 years before I got fully invested in lean. And one of the things I love about social workers is that they are problem solvers. The job is really designed to put you in a position to help people solve their problems. It's a wonderful privilege to be able to do that with people. But the best social workers not only help their patients or their clients solve the problem that's in front of them right now, they also help to teach their patient or their client how to solve future problems as they come. And I really feel how the connection strongly between that mindset and this kind of lean mindset. It's not just about solving this one problem that's in front of me. It's about teaching my people and my colleagues how to problem solve ongoing, how to be always in a position of looking for ways to continuously improve. So it becomes a way of life almost when you start to think of it that way. Craig, why don't you go ahead and explain a little further?
Sure. And, Bonnie, being a social worker, truly has what I would consider the right brain thinking around lean and the cultural change. And we certainly approach as lean practitioners, as many lean practitioners do across this industry, we approach this as whole brain thinking. It's culture change first and foremost. And at the same time, it is also about being hard-nosed and getting results, because culture change without outcomes that are achieved is wonderful. But at the end of the day, we need to be whole brain thinkers and also have the left-brained approach to getting results and measurement. And on that last slide, you saw a lot of organizations really don't implement mindset, skill set, and tool set. They miss the mindset underpinning of it all. And the skill set and the tool set is there, and they'll get results. But the question is, can they sustain those results, and have they baked it into their culture to continuously improve? And when things get tough, do they abandon their methods and tools and revert to old habits? And in a true lean enterprise that really thinks of it culturally, and it's supported by the top leadership in driving that culture and developing that culture, you will see unprecedented levels of results. We've seen this time and time again. Organizations in the peri-op environment that think that it's not possible to get first case on-time starts over 90%, because right now they're at like 15%. They can't start a case to save their life on time, or they can't remove the defects of patient harm. In lean in healthcare, with the aim of zero defects, it is well documented that you can see productivity increases, you can see quality and safety improvements and defect reduction. And as you address the 7 flows of medicine, as you see here, and root out the waste, you get those outcomes, your true north, if you will, about improved quality and safety, patient and staff satisfaction, reduced costs, and a greater financial viability. So it takes a culture that's committed to lean improvement and becoming a lean enterprise. And we're going to try another polling question here and see, for those of you that are using lean, if you could answer the question here about what's the commitment level in your organization around improvement work. So we'll take a moment here to answer these questions. And I'm going to have Emily check in with us here on the polling questions. Emily?
Great. Thank you, Craig. So On24 is experiencing some technical difficulties at the moment. I've tried to reach out to them, and I haven't heard back. I know everyone is very concerned with getting their CPE. So if you can respond in the Q&A window with the letter of the answer you choose, hopefully we can still get everyone their CPE. And hang tight. We appreciate you hanging in there, and I'm so sorry about these technical difficulties. And I'll turn it back to you, Craig. Thank you.
Thanks, Emily. Okay. So while people are attempting to answer that, hey, we actually got some results. Okay, so we've got, all right, this is good. This is good. So, how committed are we to lean and lean healthcare improvement, and whether it's Six Sigma or it's lean or otherwise, we can see the results here. 40% are uncertain, 20% somewhat, and 14%, roughly 14%, who are undergoing a lean transformation. It's pretty interesting results, Bonnie.
Yeah, it is pretty interesting. Craig, can you explain a little bit the difference between lean and Six Sigma and some of the other methodologies, improvement methodologies that you hear people talk about?
Yeah, that's a great question. We often get the lean versus Six Sigma question. And as a matter of fact, in my old organization, we started down the Six Sigma path, as many did, and then we moved over to lean. If you go to a manufacturing where all this originated, you see lean and Six Sigma living side by side. They're not competing methodologies in any way. They're very complementary to one another. I think the difference is in the application. What problems are you trying to solve, and what is the right improvement method that you need? Typically, you hear lean as having the added cultural component that Six Sigma does not. And Six Sigma is really a tool set that's used for creating much more, reducing variability significantly and a far greater quantitative analysis. So when you need things like, when you're getting to nuclear power plants, or you're into modifications to big medical devices, if you're GE and you're building the MRI, you cannot have variations. Six Sigma methods would most apply there. I think it was best said by my old friend Grant Davies as he and I were contemplating the lean journey at Sutter. Grant said, do we need to hit the beak on the rooster on the weather vane of the barn, or do we just need to hit the broadside of the barn in improving healthcare? And so lean is can we just hit the broadside of the barn in healthcare because the waste is so prolific? But if we need to get super targeted, then Six Sigma tools apply. So they aren't competing at all. They're actually quite complementary. Now, this is pretty typical of what we see in healthcare, these results, so we do have a fairly representative audience. And we'll talk a little bit more about the proven results a little later on in detail, but I wanted to call your attention to what some of the research is showing. We're proud founding sponsors of the Center for Lean Engagement and Research at UC Berkeley. The center is run by Drs. Stephen Shortell and Tom Rundle, and we're in our 20th year in lean in healthcare if you mark it back to 2000 when we started to see the likes of Virginia Mason and Park Nicolette and ThedaCare bring it in for manufacturing. I know other organizations were working with it before that, but it really developed in earnest about 20 years ago. And CLEAR, we sit on the board, but we don't direct the research. So this is a resource that I want to call your attention to that is starting to gain more and more momentum. In 2017, the first all-hospital national survey was conducted, and you can go on the CLEAR website to see those results. And the initial paper in 2018 about how is lean being used in transformational performance improvement came out, and in June of 2019, a derivative study on the relationships of HR, finance, and IT, which are critical factors in helping performance improvement go with success, has also been published. And there's also a recent study that just came out, I think just before we produced this webcast, that is around public hospitals. And are we seeing improved outcomes in public hospitals because of the adoption of lean? Now, this is very early days in the research and creating the evidence, but the research is showing that lean is having an impact. It is gaining roots. It also underscores the importance of persistence at the leadership level to keep the organization focused on lean. 69% of hospitals are using elements of lean or performance improvement, and 12.6% showing some degree of maturity. And that maturity, again, the long view is important here. Short-term wins are absolutely possible. And we see that time and time again as an organization ramps up its lean efforts. And then it gets more and more challenging. And the question is, can people push through the change curve when things get tough to continue to persist, to then start seeing the next levels of breakthrough? And there are many organizations that are doing that. On CLEAR's website, there's an annotated bibliography that attempts to catalog all of the improvement work happening in the industry. So I'd like to direct you to that research, and a great place to keep current on what's happening. And shortly, we'll share some of our results on what we've been seeing across the area of lean improvement on a more specific level. But Bonnie, back to you on what's it like to live in an organization that's going through a lean transformation.
Thanks, Craig. So it's quite an experience, of course, to work in an organization that's going through a lean transformation, and then also be in the position to partner with and coach organizations that are going through the same. So and you'll know when you're walking through the halls of a lean organization, you'll know that you're in one, because these are some of the things that you're going to be able to see or possibly feel that are the hallmarks of an organization that's it's using lean and is entrenched in lean as a model for improvement. So I mentioned this earlier, the respect for people. That's a felt thing. It's also something that you can see in the way folks interact, in how improvement ideas are bubbled up and acted upon by the team, by presence of leadership on the Gemba. You referenced a leader earlier, Grant Davies, who we both had the opportunity to work with. And one of the things that Grant did that was so revolutionary was he made it his business not only to be on the Gemba every day to see how the workers were doing and to watch as operations were unfolding each day, but he actually took the time weekly to spend his office hours in what was essentially my office on the Gemba, so that he was highly visible, he was accessible, he was open to conversation, and he knew the people who worked in the area by name. They knew him, and it really compressed that leadership, the vertical nature of leadership in some organizations, so that it felt like the leader was with me side by side, working along with all of us to make improvements and understand the challenges of what everyone's facing day to day. There's a lot of power in that kind of executive leadership model. We had excellent aligned strategy deployment, and what I mean by that is that the leaders and executives of the organization had defined the strategy. They had defined our targets and our goals, the vital few, must do, can't fail, as is often said, and those were clearly communicated throughout the organization top to bottom. And it was sort of divided up and defined in such a way that everyone who works in a lean organization knows and understands how their role and their activity each day feeds into these larger goals and targets. And that's really important, because sometimes when that type of strategy and target alignment hasn't been created, people are working all day and they're working hard, but they don't understand how the work they're doing has an impact on the larger organizational objectives. And when you can't make that connection, that's where the burnout starts to creep in. That's where people can feel disenfranchised, because they know they are working hard, but they don't see how that hard work matters to these larger organizational goals. So clear communication and transparency around that is important. You typically see that through the use of various levels of visibility boards, daily management system boards, which usually involve daily huddling and communication around the huddle board to the sort of conditions. How's business running today? How are we doing in meeting targets? What challenges and obstacles are present that we need to address right now in order to ensure that we can have a good day today? And then there's also a problem-solving component to that, where frontline workers are empowered and encouraged and taught how to raise their improvement ideas. Talk to your local leadership about those. What can we work on? What will have an impact? Let's do those things, and let's measure and see what kind of results we got. So there's this foundation of measurement and science, along with frontline problem solvers being empowered through their leaders, and then that clear communication top to bottom about targets and goals. So some of this is, what I was describing when you're working in a lean healthcare organization, or really almost any lean organization, even healthcare related or not healthcare related. You've empowered that frontline worker. They are the ones who are what we call value creators. I've heard that term used and I like it. You'll sometimes see servant leadership tools that talk about inverting the typical triangle, the typical organizational triangle where you have your executive at the top and your frontline worker at the bottom. There's a powerful idea behind inverting that so that the people at the top of the triangle are the value creators, the frontline workers, who's doing the actions each day that drive your business, whether that's healthcare or something else. Regardless of what the industry is that you're in, you'll see these same hallmark characteristics. Targets and results are highly visible, easily understood, easily obtained by the people who are doing the work and all throughout levels of leadership. There's standardization across service lines. There are certain activities that people are performing every day that can be standardized to improve the safety and the quality and the predictability of those operations. The more you can do that, the better results you'll get. Everyone at every level of the organization is empowered to solve problems. That's a key piece. The people who do a job are much better positioned to solve problems that relate to that job than someone who's 1 or 2 levels away working in a conference room. That's a nice idea, but that's more traditional management style where the managers get together and say, well, they should do it like this now, and then go tell people what to do. Lean doesn't do it that way. We say, well, you do the work. Help us understand what the barriers and the challenges are, and then let's put our heads together and come up with some solutions that we can test. Every change or initiative that you undertake gets tested using the scientific method, PDSA, you'll often hear it called, or PDCA, which is this cycle of continuous improvement. You don't just say, here, now do it like this. Great, we solved that problem. Now I'm going to walk away and do something else. What you have in that scenario is you have a proposed solution. You're going to test it. You're going to see what kind of results you get. And then you'll make some adjustments based on what you've learned, and you'll keep going forward, constantly, iteratively improving it until you've gotten to the point where it's without error, without defect, every time. And even then, you periodically go back and check on it. So it's not just a one-shot thing. It takes that gentle persistence all the time. Oh, and lastly, and most importantly, of course, especially in the world of healthcare, but again, true in other industries as well, your customer, in our case, typically patients, but there are some folks who work in healthcare and their customer is not actually a patient. It can be something else. The customer or the patient is always at the center of everything we do. When we talk about value creation, what's meant by value, that's something that teams talk about and try to decide what's valuable for us, what's valuable to our customer, what's valuable to our patient, why are they here, and what can we do that will bring them closer to healing, bring them closer to wellness, that will change the form, fit, or function of the problem that they've brought to us. Those are the kinds of conversations you have around value. However you land, the customer and the patient are always at the center of all of the improvements that we make. So this
Bonnie,
slide,
if I can interject
Please.
On that one, how often are you seeing improvement teams have patients involved in actually framing the problems and defining value from their perspective? I mean, direct patient engagement. What are you seeing in that space?
That's a great question. There's a variety of levels, and I think it's the most evolved lean organizations, the ones who are really sort of courageous and brave in their problem solving. They include the voice of the patient. So if they're going to convene a team, what we would call a Kaizen team, to do a rapid process improvement workshop or event designed to target a specific issue, they'll invite a patient to come. And they'll say, please sit at the table with us. We want to hear what you have to say, because this whole enterprise is designed to meet your needs and offer value to you. And if we don't know what you're thinking or how you're feeling, how good of a job can we really do with that? Mm-hmm. So I would encourage, again, no matter what industry, healthcare, it's the patient typically, but it can be other customers, and in other industries, other people. But asking, being transparent, finding out what matters to you. Tell us about your experiences. What do you think? Do you have ideas of how things could be better? They might be the best ones to ask. So don't be afraid to inquire and involve. Some clients that I've worked with have a very rigorous system for doing that, and they won't proceed with a Kaizen event or workshop if there isn't a patient representative there.
That's a best practice right there. Yeah, that's a best practice right there.
So on this next slide, you see a series of quotes from various levels of participants in rapid improvement workshops, as I mentioned, or people who've participated in strategy deployment conversations. So you'll see some executives represented here, clinical staff represented here, managers represented here, and you can read the quotes on the slide. The thing that I want to stress, though, about it is that these kinds of quotes come from the portion of a workshop where people engage in active reflection, and they share with the other members of the team how they feel. How do I feel about my performance? How do I want to show up differently and better today? And this practice of reflecting on how you've done things and how you can improve the way you're doing things is another cornerstone element of lean. And oftentimes in modern world, we're so busy, we don't make time to, or create time, develop time, plan time to just sit and reflect. It doesn't have to be very long. It could be 5 minutes. But to sit down each day and say to yourself, how did I contribute to improvement yesterday? And what am I going to do differently today? So sort of rapid improvement workshopping yourself and your own little PDSA, personal PDSA cycle for assessing your results and making adjustments and doing better the next time. So that's a practice that I think we could all engage in starting today. But it is definitely foundational to lean improvement and showing up as a lean practitioner. So another polling question.
Hey, Bonnie, before we do the polling question, I think Emily's got a little update on the ON24 technical issues.
Oh, okay,
Emily?
Let's hear it.
I do, thank you. ON24, a webcast provider, had a significant issue just a moment ago that impacted all of their webcasts that were happening. Unfortunately, we were one of those. They have assured us that everything is back to normal now. You'll just need to take a second and refresh your browser. And if you'd please do that now, the polling question that's live should reappear, and any audio and slide syncing issues should be addressed. Thank you, everyone, for your patience, and I'll turn it back to Bonnie and Craig.
Okay. Are you able to see the polling question, Craig?
Yeah. So if you wanted to use a lean management system, would you know how to go about doing it? So that's our polling question. I want you to take a moment there, everybody. And while we're doing that, I've got a question for you, Bonnie. You know, you've talked a lot about the role of leaders and collapsing. I like that, how you collapse the vertical nature of an organization. When it comes to lean transformations, you know, what have you seen in terms of the role of the leader in whether or not a lean culture is going to take root or not? What's the responsibility of the leadership in doing that?
Well, this probably won't come as a surprise, but leaders are absolutely essential. Your leaders lead, and people follow them. And as goes the leader, so goes everyone else. So if the leader doesn't engage fully and exhibit the behaviors, demonstrate the philosophies, start integrating the beliefs into the way he or she shows up for work each day, The folks who work there absolutely will not follow. And what I've seen it happen both in the positive and the negative. So I've seen highly inspirational leaders who, through their behavior and their actions, motivated teams who really lacked any motivation, and you'll see incredible results. But I've also seen the opposite, where you'll have a motivated team. They really want to dive in and start making improvements, but their leader's not really engaged. They're not coming to the Gemba or coming to where the work is done. They're not supporting process improvement. They're not supporting problem solving on the front line. If you're in that unfortunate situation, I promise things will get extinguished fairly quickly.
Yeah, and we see the polling results here, but and it's a little bit of a split across the A, B, and C. One of the things I'd add to what Bonnie just said here is, when you're truly taking a cultural transformation approach to lean in an organization, it's the top leaders have to study a new way, and they have to study together. And we often see that organizations where it starts with the senior-most leaders and physician leaders. Let's not forget the physician leaders, everybody. They are critical to the success of this. When they begin to learn a new way together and create that space Bonnie was talking about to reflect on, well, how are we leading this organization? How do we want to lead this organization? Getting out of the transactional nature of the day-to-day is essential. And then learning by doing, not just sitting in a classroom and learning a few concepts or how to be a sponsor in name only, but how to actually take the time and go to the place where the work is done and help facilitate teams. Not be the traditional top-down approach, but be a facilitator of change and dedicate your time to that. I was recently with a hospital president who just got his certification, and he was in scrubs. He was walking around the hospital in scrubs that week, and because he was facilitating the peri-op environment. And the people who were on the team were astonished. The hospital president is here, and he's helping. And he was asking wonderful questions. People get to certain levels of leadership because they have the answers. When you're in a lean enterprise, the value is not placed on who has all the answers, but who has the best questions. And so oftentimes you'll hear this referred to as humble inquiry, the work of Dr. Edgar Schein, which is a cornerstone of leading in a lean enterprise. So let's move along. Oh, yeah. Go ahead, Bonnie.
Can I add one more thing? I just want to tag on to that, the really key role that physician leaders play if you are working in a healthcare organization. Even if physicians are not titular leaders and they're just working as doctors, the reality is that a doctor is a leader. That's how it, boots on the ground, that's how it works, that's how it feels. And so you really want to be sure that your physician team and your physician leaders are engaged and are ready to do the work alongside everybody else. If physicians are not engaged, you can really run into some challenges there.
Yeah. I was on a call yesterday where people were talking about the gap that exists between administrative leaders and physician leaders. And I often find that when you do it right in a lean enterprise, this is a way to bring them together and close those divides, because they have a way to have a common language of seeing how to eliminate waste and create value, and with that alleviate the burden on the people who are taking care of patients. So I get the honor of being the left brain guy today, talking about the results. And maybe this is our thing, Bonnie. I'm the left brain guy, and you're the right brain social work side of this. But together,
I'm comfortable with it.
Okay, good, good. But return on Kaizen is, for our old friends. I see a number of names on the screen of old friends who knew us before we were Moss Adams as the Rona Consulting Group. We're still that same great group of folks now on the wonderful platform of Moss Adams since 2017. And this is something that is a newer innovation in our world. It's called Return on Kaizen. Kaizen, that Japanese word of the process of changing for the better. And and really embodies that spirit of continuous improvement. And over the last couple of years, we've been developing a more rigorous measurement system around calculating what is the return on Kaizen. And it's evidence-based. It's a disciplined system where we are aiming to capture from every value stream that is touched with our clients, the ability to quantify the waste eliminated. And part of that, this isn't just monetary, everyone. This is also about lives saved. When we're getting into clinical quality, CAUTI and CLABSI, how many lives are being saved? And how much avoidable harm is there? Sepsis is another one. So we take a holistic approach on this to go beyond the money. You know, the hard dollar savings, the soft dollar savings is important. The lives saved is crucial. And when you take this down to the calculations, even down to the waste of footsteps of a nurse, and you look at, well, what does it mean if we have eliminated the waste of motion of a nurse or a medical assistant in the ambulatory environment? What does it mean? Well, it means, sure, you can calculate, okay, here's the steps. Here's what those steps are in terms of that person's time and the cost of that time. And you could be very myopic and have only the financial lens if you wanted to be. But I think the real value when you think about a balanced scorecard of outcome measures that you're going for as an organization, which is far more than just financial, it's also about service. It's also about quality. It's also about the engagement of the people, you know, the quadruple aim. I think what you need to really take in is that waste of motion means that that nurse or that medical assistant had more time to care for that patient, more time for direct interaction with the patient, more time to run the checklist to make sure that a patient wasn't going to be harmed. So it's far more than the financial components. And so as a very simple example, the foundation of the Toyota House, which Bonnie didn't show but outlines the methods and tools, is 5S. It's a way for visual organization and visual management, sort, set, and order, shine, standardize, and sustain. The most simple example is the terrible medication room on the left, which then, through the efforts of the people who do the work, turn into a much more organized, visually controlled workplace on the right, which creates a foundation for safety at a medication pass. And when you look at what a return on Kaizen example can look like here, you look at and you see the typical soft savings and hard savings. And this is an example of an organization that we have worked with where across, in their particular case, multiple nursing units, it's a large academic, they're seeing a return on Kaizen in terms of hard dollar and soft dollar savings of a significant amount. And you can see some of the numbers here. And it calculates then into, you know, miles or hours of time saved for that the people who are working in these processes. The differentiator comes when you look at, they also took an approach and said, well, but wait a minute, when we have a workplace that is in control from an inventory perspective and everything's in the place where we need it at the right time, and it is shined, meaning infection control translation, what happens to our C. diff rates? And this was wonderful that they took a perspective of going much deeper in 5S, beyond inventory management, beyond the savings of steps, but actually looked at what does this mean to our patients in terms of quality and safety. And so return on Kaizen really takes that whole brain approach. And when we look at organizations and say, well, what is possible? You know, last year we had a year where we worked with a handful of clients that when you see that they apply the measurement rigorously, when they are making sure that every improvement of it has baseline targets of what they want to achieve in the elimination of waste and the value created for a patient, process metrics. When you see that they are rigorously going at 30, 60, 90 days post-event to say, how are we doing? When you go back and look 6 months later, how are we doing? And keep checking check, check, check. Are we getting the desired results? Is the trend line on that improvement work going in the right direction? We see that an organization can throw off upwards of 5, 6, 7, 8 times their investment in what they're doing in Lean. Now, it's a pretty well-known fact in Lean that some of your administrative processes like revenue cycle, because this is not just about clinical processes, administrative processes count as well. Sometimes there's an incredible amount of waste in those that create this additional pain for patients that we don't even think about day in and day out, like, okay, you're sick, or you've had surgery, and then the bills come, and you can't sort it out. I'll tell you, my father had a hip replacement a year and a half ago. I am still getting a regular call from him about the administrative burden of all the defects in the billing process. It is sucking up his time, and this happens all day, every day. But back to return on Kaizen. We can take across any of these value streams, and we, no matter the organization or who you work with, you should be endeavoring to develop a rigorous system of measurement that quantifies very clearly how much waste is being eliminated. Unfortunately, as we go around this country, my experience is that we're extremely poor in measurement. We are rich in data, and there are dashboards galore, and there's public reporting that is to the nth degree. When we talk about truly transforming healthcare, beyond payment reform, which has really been the main type of reform we see driven by the government, it's not actually delivery system reform as it needs to be. We at the front line are very data and information immature. And I think the next wave of lean transformation is going to have a much tighter tie to much more high-quality analytics to fuel at an even more rapid rate, that improvement. So another polling question for you all. Is your organization pursuing a Baldrige or a high-reliability journey or similar designation? If so, how do you view a lean management system in achieving these results? So we'll let you all ponder that question and answer.
Well, Craig, while the group is answering the question, I'm curious to know how you would connect lean with high-reliability organizations or possibly the pursuit of a Baldrige. What are your thoughts on that?
This is an interesting question, Bonnie, and the high reliability organization or the high reliability framework by Dr. Chasson from the Joint Commission, I think, is a really great framework, and it challenges the industry. Can you be more reliable or as reliable as the airline industry or the automotive industry or whatever it might be? And we see HRO across the country, and I think one of the things in HRO you have to remember is that one of the recommendations in HRO is that you have a robust process improvement framework with culture change. This is a really important piece, Lean, Six Sigma, with the underlying culture piece so that you can sustain high reliability. The Baldrige is also an interesting one. There is a really, really tight connection to Baldrige. I think the challenge with organizations that are pursuing a Baldrige and use the Baldrige framework for their how to lead their organizations, Baldrige is not, and high reliability is not a how. It is a measurement of where are you at any given time. It's not a methodology. It's not a management system. They're important frameworks to mark, okay, where are we on the journey, and do we check all the criteria for being designated a Baldrige winner or a Sterling winner at the state level or being highly reliable? But ultimately, it's only going to come through something like a lean management system, a true management system that's going to help you to sustain results. I think there are some organizations that I work with that see high reliability organization and lean as extremely complementary, and the lean is their way of becoming highly reliable. I've seen other organizations with the Baldrige who they say lean is our way, and the Baldrige is just an award. So I would caution people to get attached to awards as an outcome. Rather, get more attached to what is a cultural transformation and building that spirit of problem solving that you were talking about, Bonnie, across the organization. So let's see what the results come back as. So, okay, 54% aren't considering any of these designations. Okay, well, and another 23% are considering, and only 9% are pursuing it. So good. Thank you. Thank you for answering that polling question. And again, sorry for the earlier problems with the polling question. So let's move into how do we realize this vision?
Thanks, Craig. So I guess hopefully at this point you're thinking about, well, what would this look like for me, or how do I get engaged in this kind of work? What kind of foundation do I need? So listed here are some of the key ingredients that if you're thinking about building lean in or starting on a transformation journey of whatever size, this is maybe serving as a bit of a checklist for you to know whether you're ready or not. Because starting on a lean journey, if you don't have these key components, very frustrating for everyone. You'll get very limited results, and it makes it harder to start it again in the future when you say, okay, but we really do want to do it, and we weren't ready before, but we're ready now. It's harder to crank up the machine the second time. So consider whether you're really positioned well. Do you have leadership constancy with a long view? Do you have agreement on your leadership team about what the strategic objectives are for this organization, the vital few? Do you have a direction or vision of where you want to be? How are you going to measure success? What are the goals? How will you measure progress toward the goal, and how will you know if you've achieved the goal? Are you ready to start engaging your physicians and your staff? Are you ready to take on the work of educating and training people, top to bottom, not just the executives in some little hidden away room, but there's education that needs to happen top to bottom throughout. So from the very, so C-level all the way down to frontline worker, everybody needs to understand what's happening and know how they're to participate. Do you have the bandwidth or the resources to develop an infrastructure? What Craig, I'm sure, would agree is when we work with clients and there's no infrastructure present, so you're just adding more work to people who are already functioning as managers, directors, vice presidents, and you don't also identify and allocate resources for support and coaching, it's very tough to get it done because people are already feeling so burdened. Asking them to take on another burden gets things off on the wrong foot. So you want to have a parallel track there for an embedded internal office. And those folks get their own kind of training on how to measure, how to support, how to coach, and how to build a lean model that is really what's right for your group. So those are some of your key ingredients that you want to have. Now, when you have those things in place and you start to work, a little hard to read on this fishbone, but these are the things that you will, the concepts, more technical lean concepts, that you will start to see manifest themselves. Your leaders will be engaging in the strategy conversations where they will start to look at where we're headed, how will we measure success toward those things, how are we going to show up differently as leaders, goals and targets, and how can we make those visible, not just to us, but to everybody in the organization. And then as you're working your way deeper and deeper through, you start talking to leaders at different levels, helping them and coaching them toward the leadership behaviors that they need to support the work, embedding a daily management system. And what we mean by that is daily work for the leader. How does leaders show up each day? How do they support their team? How can they be communicating with the team and measuring progress? Educational components, teaching people the tools through the use of either executive or lean certification type education, how to write an A3, which is a problem-solving document that we rely on all the time for framing out problems. These types of tools and methods you'll see, and we're happy, of course, at a later time to tell you more. A couple other things, Craig, why don't you go ahead and talk about this one, the president's diagnosis?
Sure. So, short story on this one as we come to the top of the hour is that lean in healthcare needs a maturity model, and the president's diagnosis is something in the book by Tom Jackson, Hoshin Connery for the Lean Enterprise, and I think at a later date you'll start to hear us talk more and more about the even more rigorous maturity model to know what stage is an organization at in its maturity and becoming a lean enterprise that is sustainable through leadership changes. Oftentimes we start with being able to just simply see what's going on in our organization, see the waste, and then we move to point improvements and then line improvements, all the way until we have it fully embedded in the organization. But this is a conversation for another time in much more depth, and I think it's a need in the organization, particularly as leaders are going through and trying to understand maturity of becoming a lean enterprise. Very similar to what EMR adoption model was for IT in healthcare. And so in conclusion, we just want to remind you that, it's about reducing waste, providing unprecedented value for our patients and our communities, and it's ultimately a culture transformation and trying to make sure that we are engaging problem solvers across the organization in alignment around creating that value for our patients. And the transformation mindset, it's all about small steps first. Bonnie's a baseball fan, probably the best knowledge in baseball I know, and Bonnie used to say to me, "Hey, Craig, it's a game of hits. It's a game of hits. We don't need home runs every time." And so transformation mindset are those small steps. But it's hard, and you can see here the quote, "Look, I promise I'll change. What I can't promise I'll change, but I can promise I'll pretend to change." Well, if you're going to become a lean enterprise, there's no pretending. Thank you all for joining us today. I'm going to turn it over to Emily to wrap it up.
All right. Thank you, Craig, and thank you, Bonnie, for a great presentation today. I'm aware that we had technical difficulties throughout the presentation on 24, had an outage that impacted all of the live webcasts at the time. Because of this, you will not be able to immediately download a CPE certificate. I do apologize for that, and we are going to do our best to look into awarding those manually after the webcast. And a copy of the recording and presentation slides will be sent via email to everyone who registered. Here is a link to an online survey where you can provide feedback for today's presentation. Please take a moment to complete this survey, as your feedback is very important to us. Thank you for joining us, and we hope you'll join us again next time.